Hi everyone, we'd like to welcome you to Real Talk. I'm your host, Pat Terrio, and we are here at Middle Georgia State College with Radar Conaway, the president of the Dublin Lawrence chapter of the Delta Sigma Thetas. And we're here because of the World AIDS Day Symposium that they have going. How are you doing, Radar?
I'm doing wonderful, and how are you?
Doing very well. You know, we're so pleased at all the work that your sorority does for the community and for individuals here. Talk to us a little bit about what's going on today and what's happened in the past with this type symposium.
Okay. December 1, which was yesterday, is recognized as World AIDS Day. We're doing our awareness program today to raise awareness about the HIV AIDS epidemic and to try to educate and make people more aware of what is going on in our society.
Absolutely, and of course World AIDS Day started in 1987, and so tell us about what we're going to expect today, what's going to be happening.
We have a lot planned, and we're so thankful for the support of Middle Georgia State College. This is our first year collaborating with them, and it has been an awesome experience. But today, students will receive literature about HIV, AIDS prevention, awareness, and treatment, and most of all, how to take care of their health and the health of others. It's all about prevention and knowing how to take those necessary precautions.
Absolutely. You got some of the Delta girls here with you.
Yes, I have my SARS with me.
and just preparing for this, you did it last year. What's the difference in last year as opposed to what you're doing this year? Because is this the first time at a college?
This is the first time that we're hosting it on a college campus. Last year, event was smaller, but this year the committee actually stepped up and wanted to do something on a grander scale. And so we're hoping that this event turns out to be exactly what we proposed it to be.
Absolutely. And what feedback did you get from last year concerning this, doing it at the level that you did?
People want us to do it bigger and better. Last year we did it out at East Lawrence High School, basically a table booth type display, and people were very eager and they actually supported the cause. And so we said, well, we can step it up a notch.
Absolutely. And so you've got speakers and you have vendors.
We have speakers from the South Central Health District, and we'll also be conducting confidential testing.
Oh, wow.
So that'll be done as well.
Very good, very good. So some college students can come out, and of course the community are going to be out here today.
Yes.
All right. Well, we're looking forward to it, and we want to meet the definitely the speaker and the people that you have, and of course venture around and see how the symposium goes today.
All right.
All right, we thank you so much, Radar. Everything that you're doing with the Delta Sigma Thetas and the work that you all are doing is so positive and so wonderful for our community.
Thank you.
All right, Radar Conaway, ladies and gentlemen. We're pleased to have the guest speaker for the afternoon, Robbie Giddens. Robbie Giddens, how are you?
Good, how are you?
Very good. Tell us a little bit about yourself and tell us about the work that you do.
Well, I'm the HIV coordinator for the South Central Health District, which is Lawrence County and the surrounding 9 counties. I write all the federal grants and state grants for HIV services in our community, and I run the only HIV clinic here in the district.
Tell us about, when you think about HIV, when you think about AIDS, a lot of times people don't want to talk about it, and so many different things through the years that have transpired, and we've lost so many people that we know from this. How important is it to have the knowledge that we have and what you offer with South Central?
HIV knowledge is priceless. Especially in this area, there's a lot of stigma associated with HIV, and a lot of people don't want to get tested because of stigma. Or if they know someone who's positive, there's a big a stigma against people with HIV in the community. So one of the biggest things is getting yourself tested, knowing your status to start with, and that's half the battle.
You're right, and knowledge is power, because when you talk about a stigma, a lot of times people don't understand.
No.
They think that there's, different things, like if I touch you,
I can get it.
Yeah. And so you're going to be speaking today.
Yes.
So what things you're going to be sharing with the public just to kind of help them understand about the epidemic?
Well, I've been with the district since 2006, specifically in HIV,
Right.
and I've seen a lot of changes in the HIV environment and landscape. When I first came, there were very few patients, and now we have a lot of patients. So I'm going to kind of share a little bit about the numbers and about how things have changed just in my eyes as I've been watching the evolution of HIV in our community, because I think a lot of people are unaware of how prevalent it is.
Right here. And
yeah,
that's going to
here.
bring it home. It's kind of one of those things like the shock value of things where you think it's out there, you think it's just on television.
It's down the street. It's here.
Yeah, it's in your neighborhood.
Right. It's in your church, it's in your school, it's in your community.
Well, we certainly appreciate the work that you do because it's so very important, and we look forward to hearing you speak today.
Okay, thank you.
All right, thank you so much. Ms. Giddens, everyone. And we've got Mr. George Mims with us as part of South Central Health District. How are you, sir?
I'm doing great, and yourself?
Very well.
Yeah.
You know, we're pleased to be out here today. We're so thankful that you all are here to talk about what you're going to do. Tell us a little bit about yourself and the work that you do.
I'm George Mims. As she said, I work for South Central Health District. I'm the city HIV prevention coordinator. And when I do work with outreach, with working to stop the spread of HIV and STDs in this area.
Now tell us about your radius, because when you say South Central, that covers a lot of area.
Yes, it covers 10 counties that we cover in this area.
And how long have you been working in this position?
I have been working for 7 years.
And what have you seen have you seen an increase or what have you seen as far as like, because we talked a little bit from Ms. Giddens talking about people don't realize that it's right here.
Yeah, so we have people of all ages, races, and sexual orientations who are affected by HIV that in our clinic that we have here in this area. So it's affecting all demographics of people today.
And so you do preventative things. So when you're out in the community, what things do you do? Do you go to schools? Do you go to churches?
Yeah, we try to go out anywhere that will allow us to go out and speak. We go to churches, we go out to schools, anything to promote prevention, because we ultimately want to stop the spread of this disease.
Absolutely. And so you're going to be doing some testing today?
Yes, we'll be doing testing today. We'll be talking about prevention methods as well today.
What is the process that you go through for that?
For the testing process, what we use a rapid test. It's called an oral quick. It's a 20-minute process. It's no blood. We just do a quick oral swab. Once across the top of the gum line and once across the bottom of the gum line. And within 20 minutes, you'll have your HIV results.
Within 20 minutes?
Yes, 20 minutes. And it's 99.9% accurate.
That's amazing. So outside of the symposium, so if there's some people out there that want to make sure that they're tested to find out what their status is, what do they need to do?
You can go to any of our health departments that's in our area, and it's free of charge to be tested at any time at any one of our health departments.
Very good, very good. Well, we appreciate the work that you do, Mr.
Thank
Mims.
you so much.
All right, keep doing great things.
Thanks so much.
George Mims, everyone.
Guys, we know what it's like. Good people like you find themselves in situations like this all the time. Baby, when you were young, your father lost his job, and we found ourselves in the same situation that you guys are in right now. It was the hardest time of our lives, but a friend of the family recommended Lumen Earl.
Lumen Earl helped us out years ago, and he'll help you too.
Lumen Earl, solving people's financial problems for over 30 years. Call today for your free consultation.
And ladies and gentlemen, we've got Miss Tanisha Campbell, who is over the Student Services here at Middle Georgia State College. Nice to see you.
Hi, nice to see you as well.
Tell us a little bit about the work that you do here on this campus and talk to us about the collaboration for this symposium.
As a Student Services Coordinator, I conduct student activities here for the students, make sure they have fun activities, engaging activities. So, you know, outside of the classroom, they have something to do as well. This World AIDS Day event is a collaboration with Delta Sigma Theta Sorority Incorporated, you know, for the community and students, just to bring awareness to HIV in the community and give them an opportunity to get tested and know what their status is.
Absolutely. And so as the Student Services Coordinator, what did you do to kind of get the kids to generate the interest and getting students to come to be a part of this?
It's a matter of emails, you know, just going out there, talking to the students, letting them know, giving them incentives to come, letting them know what they can benefit from by coming to this event.
And there's lunch over there as well.
Right, yep, it's free food.
Food always,
students love free food.
And, you know, I remember when I was in college and undergraduate, I mean, you know, it's like your position, just trying to come up with interesting things for the kids to do. How has that been, and how long have you been in this position?
I've actually only been here 2 months.
Okay.
Just a recent graduate myself.
Oh, wonderful.
And coming up with the activities can be a challenge, but it's still, it's no problem. You know, you just have to get to know your student population and see what they enjoy. And then, like, these students here, they just love to come and sit and relax, eat some food, be a little entertained, and then go back to their classes and about their day.
Absolutely. And something like this is so very important. We got to speak with some of the key people who are involved in this and have been doing the work within the community, and then to bring it to the college. And the Delta said this is their first time bringing it on a college level.
Yes, ma'am, it is. This is the first collaboration we've had with them. This is our first AIDS Day that we've had here, and of course my first time since it's my
second month.
Yeah.
So you're definitely getting acclimated to things rather quickly.
Yes, ma'am.
All right. Well, best of luck to you with what you're doing here, and pleasure meeting you.
Thank you. Nice meeting you as well.
Tanisha Campbell, everyone. We've got Miss Brenda Mountain with us today with South Central Health District. She's been with the company for over 17 years.
Yes.
Miss Mountain, you've got to tell us all about what you do and why you're here today.
What I do is I'm the admin ops operator, coordinator, one, and I've been working with South Central Health District for 17 and a half years. And my role is I do the billing for the clients that have insurances.
Right.
And I deal with Medicaid and Medicare. I also deal with private insurance by billing those companies. And I am also a certified tester where I can test for HIV for the state of Georgia.
And there used to be back, years ago where people who had HIV or AIDS had such a difficult time as far as with insurance to be able to even get the medication and treatment that they need. What has changed now within those 17 years that where you've seen how things have changed? What's changed?
What have changed now has been that now we have a program called ADAP. And it's our state drug assistance program to help patients that does not have insurance or Medicaid or Medicare, any type of insurance. And our program assists them with that.
Right.
So they do not have to come out of their pocket to pay it because it is a government federal-run agency.
Oh, that's wonderful. That's really wonderful.
Then there are some patients that they may have insurances, but their copay is so high that they still cannot afford to pay for their medication. But that's where our program come in. And we are the payer of last resort.
Right.
And so they must use their insurances first in order for our program to be able to step in and to assist them.
And so for the past over 17 years, you've seen some cases, I'm sure, that's really touched your heart.
Yes. There are some where, you have some patients that they want to do what they can, but they didn't know that we was there.
Right.
And just knowing now, getting the information out to the public to allow the public to see that, hey, I can get some help.
Right.
I'm just not in this by myself. And it is a very good program if people are trying to figure out, hey, I just found out I have HIV or I have AIDS. I don't know what to do. We have different programs. We have a housing program, which is called HOPWA, and it assists in different areas. But the main thing that we ask our clients, we don't want them to come just so they can get the assistance, but we need for them to be compliant. And that means they're following the regimen, taking the medication, and everything that they need to do to be able to qualify for the program, because that is very important. A lot of time the clients, out of the 17 years, I've seen where clients, they want the help, but they're not willing to do what they need to do to be able to be compliant with the program. But it's really important for them, hey, look, this is my life. And this is my health.
Yes.
And so, and I can not only help myself, but I can help someone else.
Absolutely. And the key is prevention.
Prevention.
We don't want it to get to the point to where they have to get the treatment and things like that.
Right.
We want them to be safe.
You want them to be safe. And the best for me, I always teach abstinence.
Absolutely.
That's the best way. But then you have those that are not. So we have to do other means to teach them to prevent the disease from spreading.
Absolutely. And you've got a lot of information tables over there where we saw you had the pamphlets about how to, and condoms and different things like that for people if they do make that choice.
Yes.
Okay. All right. Well, thank you so much, Mrs. Mountain.
You're welcome.
Thank you. We've got a student here, Miss Michaela Clark from East Dublin. How are you, Michaela?
Good.
Tell us a little bit about you and tell us what you're majoring here at Middle Georgia State College.
All right. I am a sophomore currently, and I am majoring in psychology. And I'm here partly because I'm the SGA director of the Dublin campus, and partly because I really like these kinds of activities and opportunities that we have at the college.
Now, do you have a lot of opportunities like this?
Well, every now and then, yes, we do. We have lunch and learns and various other things like this every once in a while.
And so you're a psychology major, so something like this would be great for you.
Yes.
Absolutely great for you. And tell us about what you're hoping to gain from this the symposium today, because they've got some speakers and they've got a lot of different activities.
Well, I look forward to learning a lot of new information, and I like to, see everybody that goes to the college and in the community actually participating in the events, and I myself am getting screened and, getting some stuff as well.
Absolutely, absolutely. And of course, I've already gotten screened, and so I think that's very important just for self-care. Mm-hmm. All right, and what about being an SGA? Tell us what that means.
Student Government Association. And, the Dublin campus pretty much takes care of the student activities mostly.
Mm-hmm. Right.
We plan events like these and make sure that things don't clash. We make sure that the students have lots of fun opportunities to actually have college life. Mm-hmm. It's not just come here, go home.
Oh, yeah, absolutely. Yeah. And, it's filling up. The room is filling up pretty quickly here.
Isn't
a lot
it?
of students. Got a lot of buzz going on.
Mm-hmm.
All right. Well, we thank you for what you're doing, Michaela, and keep doing great things.
I will. Thank you.
Michaela, everyone. Thank you.
At Roach Farm and Garden, we are stocked and ready for deer season. We have tower stands, tripods, lock-ons, climbers, corn licks, Godfreys, Big and J, Trophy Rock, ADM Rack Plus, Super Deer 20%, and mineral tubs. Stock up now on corn for $5.25 a bag and 10 for $8.25 a bag. With a variety of food plot mixes and wildlife feeders, we can surely help you attract that trophy buck. Stop by and see our large selection of Drake clothing for youth and adults. I assure you, you will not find cheaper prices on Drake in this area. Just in at Roach Farm and Garden, snake boots in virtually every size. Roach Farm and Garden at the River Bridge in Dublin. Your whitetail hunting headquarters all season long.
My name is Bobby Lothar, and I'm co-chair for this event along with Kessler Holder. We are so happy to have you here today. I'm here to tell you a little bit about the purpose. World AIDS Day is always held on December the 1st, and it is a reminder to the public and our government that HIV has not gone away, and that although there is more understanding about the disease, there are many who do not know the facts about how to protect themselves and others from HIV. We know that the stigma and discrimination continues to be a reality for many people living with HIV and AIDS. It is a reminder that there is still a vital need to increase awareness, improve education, and continue research to find a cure, and it gives us a great opportunity to put a spotlight on this disease for one day. But we're here to ask that you remember the importance of raising awareness all year round, that you use what you will learn today to act HIV aware throughout your entire life. Why act HIV aware? The CDC reports that we have over 1 million people living with HIV, including adults and adolescents, and approximately 50,000 Americans becoming newly infected with HIV every year. Knowledge is indeed power, and we want you to have the knowledge you need so that you will be empowered to act HIV aware, protecting yourselves and protecting others. At the end of the HIV Symposium, you will have the opportunity for confidential testing by a local health department. Some of you may ask, why should I be tested? Well, let me give you a few reasons. First, remember the statistics. 1 million people are living with HIV, and approximately 50,000 will be newly diagnosed with HIV yearly. It is important that you know your status. Testing itself helps to reduce the spread of HIV. An early diagnosis allows those infected to take steps to protect their partners from infection. Early treatment can reduce the risk of transmitting HIV to others by 96%. Let me say that again. Early treatment can reduce the risk of transmitting HIV to others by 96%. According to the CDC, 1/3 of people learn that they are infected with HIV less than a year before being diagnosed with AIDS, meaning they have already been infected for many years and may not fully benefit from treatment. So early treatment is the key. And for people who do not have HIV, testing is just as critical because this information helps link them with important prevention services so they can remain HIV-free. This year's theme is focus, partner, achieve an AIDS-free generation. The ladies of Delta Sigma Theta Sorority Incorporated are proud to partner with Middle Georgia State College to educate and elevate awareness of this disease. It is our hope that once you receive this information, you will understand how the virus is transmitted and how to prevent becoming infected with the virus. Staff members of our local health department have some great information to share with you today in hopes of increasing your knowledge about HIV and AIDS so that we can one day have an AIDS-free generation. Thank you for your time, and remember to act HIV aware every day.
Salvation Army Family Store is located at 1617 Telfair Street in Dublin, Georgia. We have all kind of great items in our store. We've got clothes, we have gowns, we have ties, we have shoes, furniture, mattresses, household goods, just about anything you can imagine we have. On top of that, our prices are super low. Just about anybody can afford the things that we have in our store. We're also looking for donations. We need your items so we can continue to help the community. If it's too big for you to bring, then give us a call at 478-275-7336 and we'll arrange to come pick it up. The Salvation Army is a community organization that we help people with clothing and food items. We help with furniture and rent assistance. We help during disaster times. We help with just about anything we can. We take the proceeds from the sale of our store and we use that money in our programs here in Dublin and Lawrence County. The Salvation Army Family Store, 1617 Telfair Street, Dublin, Georgia.
I'm Robbie Giddens. I'm the HIV coordinator for the South Central Health District. And if you don't know where that's at, that's in Lawrence County and the surrounding 9 counties around us. I've worked with the district, specifically in HIV, since 2006. I'm a nurse by trade. I also have a bachelor's in social work. So I kind of have the best of both worlds. I run the local HIV clinic here. I review the statistics for our area and write all of the state and federal grants that fund our area to take care of people who have HIV. So I know a lot about HIV in our community, and today I'm here to tell you just a little bit about what I have seen in Dublin, Georgia, as far as HIV is concerned over the past few years. When I came to the district in 2006, we only had 60 people who were enrolled in our program for HIV. Those are people who didn't have any insurance, who could not afford care. We had 60 people, and what we did was we paid for them to go to the doctor's office. After a while, I began to notice that our numbers were creeping up. They were getting higher and higher. And it became where I just couldn't pay for the doctor. I had to actually open up a clinic. So about 3 years ago, in 2012, I wrote a grant to open up a private HIV clinic here. It's the only clinic in the district for people with HIV that we can have an infectious disease physician who comes and manages those patients' care. They need specialty care. Their medication regimens are very difficult. They often have other opportunistic infections and are usually really sick by the time they get to us. 60 people was our patient load when I was here in 2006. Today we have 262 enrolled patients in our clinic right here in this area. So as you can see, we have a lot of active HIV going on in this area that a lot of people don't usually know about. Our youngest patient is 14 years old. Our oldest patient is in her mid-70s. We have black, white, old, young. So as you can see, in this area, just like any other area, HIV does not discriminate. The 14-year-old and the mid-70s-year-old lady, they sit in the same lab chair. They see the same doctor. They got it differently, but they still both have it. So in the past 5 years, since 2010, I like to look at a lot of documentation. I like to look back and see what's changed in the epidemic. And so I keep a lot of logs and a lot of records. Sometimes the state asks for the information, sometimes they don't. Sometimes the CDC asks for it. In the past 5 years, since 2010, I've documented 114 new cases here in Dublin of HIV. In 2008, when I first realized this was a problem, I started keeping a log of mortality. In this area, I've recorded over 60 deaths from HIV since 2008. 60 people, I would dare say that's probably almost all of this room right here if you think about it. That's a lot of people to die from HIV that you never hear anybody talk about it in this area. That's 60 documented people in this area who passed away of HIV. This year, since January, we've had 21 new cases already here. So every year it just continues and continues. I haven't seen a decline yet since I've been here since 2006. The South in general is the epicenter for the HIV and AIDS epidemic. 9 out of 10 states with the highest AIDS fatality rates are right here in the South. Georgia was ranked 4th in the nation for new HIV diagnoses in 2011. The HIV epidemic in the Deep South is largely ignored by most of the American population. There are conversations that we don't have here, and there are different reasons: homophobia, culture, racism, religion. We have patients that come in near death's door because they say, I just didn't want anybody to know that's what I had. I didn't want anyone to know that I had HIV, so I told people I had cancer. They came in at the last minute, and it's hard for us to save those people's lives when they're so sick that they can barely walk. This area just has a lot of high poverty rate, STD infections, uninsured. There are vulnerable populations. She mentioned weans. Abused women and children, there are high populations of that here in our area. There's high mortality rates. There's not much access to health care, and there's a lot less resources here than there is, say, in Metro Atlanta. My purpose today was to come and just shed a little bit of light on what HIV looks like in this area, because most people think that this is like a Metro Atlanta problem. In prevalence, we have been one of the highest districts in the state for the past 3 years for HIV prevalence for our number of population. In closing, this year's theme is Focus, Partner, Achieve an AIDS-Free Generation. And I'm here to tell you that if you're listening to the sound of my voice and you do not know your HIV status today, that you are part of the problem. The first step to treating anybody with HIV is knowing that you have it. I can't help you. I can have the best clinic in the world with the most funding and the best doctor and the best medications. If I don't know you have it and you don't know you have it, we can't help anyone. The first step is prevention by testing. If you don't know your status today, the only person who can know for sure that you are HIV negative is you. I urge you to get tested today before you leave. For anyone who'd like any additional information, we have a Ryan White consortium that meets once every quarter, and I'll be glad to give anyone more information if you're interested in working with the HIV community or learning more or working in this field. We are in desperate need of consortium team members. And there's a wealth of knowledge on HIV now online at cdc.gov. Especially the Department of Public Health has really good statistics for the state of Georgia. And I encourage you to browse those if you've never seen them. And it is eye-opening what it looks like in the state of Georgia as far as HIV is concerned.
On behalf of the Dublin Lawrence Alumni Chapter of Delta Sigma Theta Sorority Incorporated, we would like to give an elephant-sized hug to each of you for coming today. Thank you to Middle Georgia State College. Thank you to Ms. Tanisha Campbell for having us, the Student Services Coordinator. Thank you to our President for supporting us in her presence today. Thank you for our speaker, Ms. Robbie Gibbons, for speaking to you all today. Thank you to South Central Health Department, Mr. George Mims. Thank you to TV 35. Thank you to the students. We couldn't have done this without you all. Thank you to also our committee. Thank you to everyone. If I didn't call your name, we love you. We adore you, and this program wouldn't be what it is today if you all weren't in the seats or standing along the wall. So thank you.